there was the need to merge these two branches into one district. Hence, on 19th July, the first municipal executive for the association was elected. We have since assumption of office worked assiduously to bring the association to the doorsteps of members through information sharing, active participation in union activities, including quarterly meetings, welfare benefit claims, i.e. retirement, death, health fund benefits, souvenirs, loan facilities, to mention by just a few. Thus far, let me use this opportunity to thank my ever enthusiastic, hardworking regional chairman, Mr. Anaba, for facilitating the process which saw one of our sick members from Toko, Ms. Josephine Amenyablu, receive a check amount of 10,000 Ghana cedis on 26th of February this year from the GRNMA Health Fund. This was in addition to prior goodwill donations made to her as a union. To our director chair and the whole assistant director, we are most grateful for effecting her transfer from Margaret Maka Catholic Hospital, a child facility, to Ghana Health Service facility closer to her, such that she could still be on payroll whilst going on a shorter distance to work. However, she still needs more support, and hence I will encourage and urge anyone who would step in to assist her do so. The GRNMA, on yearly basis, we observe International Nurses and Midwives Week and recognize hardworking nurses and midwives. So it was on this backdrop that the municipal executives called for a filing of nominations for the 2020 Best Nurse Midwife in the municipality. The apathy of participation from all facilities, chiefs compounds, saw only 2 nominees from MMCH and Gujarat Health Center who participated in a selection interview held on May 28th. These 2 deserving individuals will be awarded today, and I'm hopeful that this will energize other facilities to actively participate in subsequent best nurse and midwife selection processes. It is worth mentioning that our representative was adjudged the 3rd runner-up at the regional competition for the first time in the history of our participation in the annual award game. Congratulations for giving a spotlight on our beloved district at the region, Madam Rita Asedo. Our ultimate vision in this regard is to see all health facilities that send their representatives given an award when nominated for an interview at the municipal level in the near future as a source of motivation. And I hope and I pray that our dear director will gladly support us when we knock at his doors to support us in this direction. Director Chair, many were our plans we hope to implement, but because we were constrained by resources, though we could not see all implemented, we had some that I wish to talk about. A team of community health nurses and a dental surgery assistant delivered school health talks on 3 major health information needs areas, i.e. STIs, substance abuse, and oral hygiene at Bishop Herman College and Kpando Technical Institute. I must be proud of the team for their good work done. Also, with the support of managers of MMCH, we collected about 60 units of blood to stock their blood bank, and this will go a long way to mitigate the frequent shortage of blood in the biggest primary referral facility of the municipality and beyond. The good aspects of our exercise was that we have established a long-term relationship with the high school such that blood collection will be done on quarterly basis. So every quarter, we just send our logistics and collect blood to stock our banks. To MMCH Nurse Manager, PLO Francois Duane, we are most pleased to have you spearhead this activity regardless of the short notice we gave you. Also, we are most grateful to the headmaster and the assistant headmaster of the HECO for the kind gestures they did us during this The theme of this year's celebration couldn't have been better carved since COVID-19 is still around and may stay a bit longer with us. While we await our able speakers to dissect this topic, permit me, Director Chair, to intimate that the pandemic exposed vulnerabilities and weaknesses in our healthcare systems owing to the sudden intense surge of cases. Demand for care and healthcare workers, especially nurses and midwives. The fear and panic that accompanied this pandemic stressed almost everyone out. However, Director Chair, the psychological well-being of the healthcare provider, especially nurses and midwives, were seemingly neglected. It was therefore not surprising in some facilities to see asymptomatic nurses and midwives who contracted the virus in the course of their duties still asked to come to work while nursing the health implications associated with this infection, mainly because of shortage of staff. In addition, nurses and midwives have been implementers of policy decisions for far too long, and there is an urgent need to take up active roles in policy decision making, especially in the midst of a pandemic like this, such that our voices could be heard better. This narrative can only be made possible for us if we nurses obtain the requisite qualifications, education and research, as well as take up active political positions to guarantee our place at the policy-making table. This blown wind is evident in the most recent MMM-DCE's nominations, where 2 professional nurses have been nominated awaiting confirmation. I humbly call on our regulatory body, i.e. the NMC, to review the age-long policy for nurses in active politics, because this and others have proven that we can administer professional care in line with our code of conduct while politicking. One major component of the building blocks of health systems, according to the WHO Director Chair, is health workforce. Patient needs are ever changing with an emerging sophisticated healthcare delivery system, just the gun thermometer you used as an example. The workforce, which nurses and midwives form almost 2/3 of the healthcare team, must have continuous professional development to leverage this care demand. Director Chair, while congratulating you and the management of Margaret Maba Catholic Hospital for the human resource development opportunities offered to our multitasking dynamic nurses, which I am a full beneficiary of such magnanimity, I wish to bring to your attention that the waiting queue is getting longer, and already it is discouraging some nurses from staying and working in the municipality. We will highly welcome and appeal for increase of annual quotas for further studies for our nurses and midwives. We are a baby district association in the Bosa Oti region and thus have a lot of challenges. But first, let me use this opportunity once again to acknowledge the efforts of our ever hardworking municipal director of health, especially regarding bringing health to the doorsteps of the indigents, such that there is accessibility of CHIPS zones at secondary schools, market squares, etc., with staff assigned to manage such places. These satellite facilities should offer staff posted there psychological, physical, and emotional comfort while delivering quality services to our cherished customers. Director Chair, permit me to share an experience I had at Market Chips during one of my usual rounds. Actually, I got there on one hot afternoon because I learned a member had defected to another association. I wanted to convince her. I was pressed to urinate, so I asked whether if they had a place of convenience. And the obvious was that they use the same toilet facility the market women and men use. They have to pay and have access to those areas which are in bad sanitary conditions. I am confident that because of how dear the market is to all of us, especially our dear Mother MP, an urgent solution will be provided to to ease the discomfort that these staff face at such facility. Also, the district association lacks a secretariat, which is hampering the smooth administration of the association. Executives do have to literally run the association in our rooms and in our bags. It makes the work very difficult. I am therefore appealing to the municipal directorate to kindly find us a place, even if a corner, a hand we could manage as our a temporary place of office for our members, so that the regional and national executives would work on a permanent place for us. Okay. Now, to my colleagues of the noble profession, today it should be our day to celebrate our good image. In as much as I congratulate our positive strides in keeping smiles on our clients amidst the glaring threats to our own well-being, I entreat each of us to search deeply within and ask ourselves some few questions. Is what I practice on the wards or units a reflection of my professional training? In case I fall sick, will I be okay with any uniform nurse or midwife to attend to me? How proud am I to proclaim in public, lately, that I'm a professional nurse or midwife? Is our uniform still giving satisfaction to clients, as it was said of the oath? As I conclude, I was once a patient and I felt it. But it appears our nightingale lamps are dying off. Just like the biblical 10 virgins, let us refill our lamps and activate our conscience at work. It is never too late. The best time to plant a tree was 20 years ago. The second best time is now, goes a Chinese proverb. Stop giving reasons for every unethical behavior you put up, and you will reap the best fruit of this noble profession. Director Chair, I welcome everybody once again and wish everyone a fruitful celebration today. Thank you very much. GRNMA.